The study I described at the session today is called the Southern Community Cohort Study, and it's an investigation into the causes of cancer and other diseases among African Americans and whites in the southern part of the U.S. The main goal of the study was to try to find out why blacks tend to have higher rates of many forms of cancer and also heart disease and other conditions than whites. Here at AACR, I talked about the major risk factors for cancer, cardiovascular disease, and diabetes in blacks and whites, and in particular looked at the effects of tobacco smoking, obesity, physical activity, and socioeconomic status, and how they affected risk of each of those diseases. One of the main findings, is not new, is that tobacco, cigarette smoking, still is the major cause of premature death in the United States. And that holds especially for cancer, but also for cardiovascular disease and heart disease, and even to a limited extent for diabetes. So the main take-home message for physicians is something that's could be repeated for the past 50 years, is that whatever can be done to help their patients, if they're smokers, quit the habit, and if their patients are not smokers, but maybe considering taking up the habits, particularly if they're youngsters, to advise against using tobacco products. As scientists, we tend to focus on our own silos. So I happen to be an associate director at the Vanderbilt Ingram Cancer Center. And so my studies are primarily in cancer. But right next door, there's a cardiovascular disease center and a diabetes center. And we need to encourage more crosstalk because some of the same exposures and behavioral factors that are involved in cancer are also involved in cardiovascular disease. So my area of interest is in cancer prevention. So to try to develop strategies to prevent cancer and learning from what's going on in cardiovascular disease and diabetes and vice versa, the folks in cardiovascular disease and diabetes learning what's going on in cancer and each group adapting what's working to apply to the other group is sort of where we're heading.